Hi everyone, this is Yufei. Today, Kyler and I are presenting on the workshop Who Heals the Healers? Processing Collective Grief and Vicarious Trauma in LGBTQ plus Clinical Training, where we presented in the GLMA's 43rd Annual Conference on LGBTQ plus health last October in Minneapolis. We want to appreciate NYU for giving us this opportunity to attend the conference, and we really thank Dr. Lira for leading us to attend the workshop. Dr. Lira is not here today, but we will cover the slides and share our experiences. So as a quick introduction, I am Yufei Lu. I'm currently a second-year student in the NYU LGBTQ plus certificate and mental health counseling program in NYU.
And I am Kyler Harrison. I'm also a second year in the LGBTQ affirming certificates. And I'm working at a private practice in New York City right now. Um, Thank you for attending our workshop.
Yeah. So here's an overview about our workshop. And our learning objectives is really we want our audience to describe the impact of socio-political stressors on LGBTQ plus clinicians in training, including how these contribute to vicarious trauma and collective grief. Second, identify the emotional challenges of holding space for others while navigating our own marginalized identities during clinical training. And third, to apply creative and community-based strategies for emotional processing, collective care, and sustaining well-being in clinical and academic settings. We want to emphasize the concept of wellness and well-being because it is very multidimensional. It's not just physiological, but it expand across 8 dimensions, including emotional, environmental, financial, intellectual, occupational, physical, social, and spiritual. All of these aspects influence our daily life and functioning and well-being. Wellness is ongoing, it's not a fixed state, so constant monitoring is essential to make sure we feel balanced in our health. And as clinicians, we need to attend to our wellness and remain intentional about taking care of ourselves in order to help our clients.
Thank you, Faye, for introducing us and talking about wellness, which ultimately is what we're kind of talking about when we talk about vicarious trauma and really who's healing the healers. Something that we like to point out in our certificate as members of the LGBTQ plus community. And kind of seeing what's going on in the world, the socio-political context, there has been an increase in fear, grief, and burnout, and ongoing uncertainties that add further stress to our roles as clinicians. So there are many states that are attempting laws that restrict gender-affirming care, ban puberty blockers, or criminalize providers of gender-affirming cares, especially for minors. We see, a law like Kansas right now, and this really has an impact on not only our clients, but us as well. So we continue to see like the 988 suicide crisis lifeline, specialized support for LGBTQ plus youth is also being discontinued under budget decisions. So we're really seeing this impact. And unfortunately, our professional training rarely addresses the emotional burden of these socio-political events, particularly as they're ongoing. So us as clinicians are exposed to these stories of trauma, and at the same time, we also experience some of this trauma. So exposure to these repetitively can start to weigh on us, especially if we have friends that are in the community, or if we're working with people in the community. Um, so addressing these burdens is essential to prevent burnout, support personal well-being, and sustain ethical, effective care. So, as Faye and I mentioned, we are both in the master's mental health counseling program, typically spanning 2 years. The first year is, learning about theory, ethics, skills, and processing our own identities, traumas, and how power dynamics play out in our personal relationships. They say when you enter therapy school that your relationships will change on the other side, and I can definitely attest to that. So there's a lot of changes going on, and so we're also managing a caseload, academic demands, and new relationships, which adds to our stress. Um, and so some sources of stress for us in clinical training is consistent exposure to trauma, a pressure to perform professionally while still learning, navigating our own identities and marginalization in the world and also in our clinical and academic settings. Noticing power differentials, how do we engage with those, um, and our own vicarious trauma. So there's also limited access to affirming supervision or mentorship. Um, and that impact leads us to, an increased risk of burnout, self-doubt, and emotional isolation, feelings of invisibility or tokenism, and difficulty separating personal and professional emotional processing. So we want to move to start talking about collective grief. So, grief is a normal and natural emotional response to loss, and collective grief occurs when a group of people experience a shared loss, which can involve not only death, but also loss of safety, identity, rights, or community. Um, and so, we're starting to see this. In the removal of pride flags and DEI initiatives and LGBTQ plus education, professional and social exclusion. Um, so it it may include grieving hope, belonging, access to care, and safe spaces. And it's often ongoing and compounded by systemic erasure. So now I'll pass it over to Faye, and they can talk to us a bit more about vicarious trauma.
Yeah, thank you, Kyler. So vicarious trauma, also called vicarious traumatization, refers to the cumulative and harmful changes in a helper's inner experience, including their cognition, emotions, worldview, identity, and beliefs that resulted from repeated empathetic engagement with clients who have experienced trauma. And it's different from direct trauma because we don't experience the event ourselves, but vicarious trauma is more gradual than acute secondary traumatic stress, and often involving deeper, lasting shifts in how one sees oneself, others, and the world. Some examples of vicarious trauma can include cognitive shifts, such as distrust of others, expecting danger, and emotional changes such as heightened sadness, irritability, numbness, or changes in worldviews such as questioning fairness, justice, or spiritual beliefs. And it can also impact our relationships, such as feeling overprotective or withdrawal from loved ones. And some somatic symptoms can include headache, nausea, and sleeplessness. Some of these symptoms really isn't named by a lot of other criterias. So it's important to be aware of what's shifting in you, in your mind and body, and to constantly monitor these. Um, yeah. And the concept of vicarious trauma is especially relevant for LGBTQ plus trainees because we often serve clients with similar identities and histories, and obviously everybody's experience of trauma is personal and unique, but added traumatic experience can influence one's worldviews and about themselves and others. And people may experience both personal and professional trauma simultaneously. But the tricky part is that supervision and training programs often do not emphasize this overlap enough. Yeah. But if we really think about the concept of trauma, it's many people can be impacted, not just therapists, counselors, or social workers, but also first responders such as police, firefighters, medical professionals and nurses, journalists, and even everyone who's reading the news every day right now. So I just want our audience to be really mindful of how our bodies react when we do trauma related work or view trauma related content to prevent vicarious trauma. And Kyler can go ahead and share some stories from the field.
Yeah, thank you, Faye. Um, so obviously Dr. Lyra isn't here to share his experiences in the field, but um, we shared with some of the people at this conference some experiences that we were having. I know for me personally, I've seen a lot of trends in exhaustion and isolation, hypervigilance, concerns about safety, code switching, and substance use to fit in or cope with this loss of safety, identity, or family members. Um, and my experience in this work has been deeply rewarding because I've built such deep connections with clients. I've been able to foster empathy and really relate to a lot of experiences and use a strengths-based approach. And at the same time, um, I'm receiving consistent conversation regarding around or related to hopelessness, anxiety, um, and like suicidality. So there is such extreme um, levels of exposure as an LGBTQ clinician, especially when I can relate to some of my clients and their experiences. Um, and so in that, I've noticed my own collective grief, vicarious trauma that can come in the form of doubting myself. Um, and I'm lucky to work with a supervisor who we can talk about this with. But I also have colleagues and other people in the program that don't feel like they can have these conversations with supervisors. Um, and so that's kind of been a bit about my experience. Faye, would you like to share some of your experience?
Yeah, thank you, Kyler. So currently I work at a site that serves marginalized populations. Many of them hold intersecting identities. I serve a lot of BIPOC populations, women of color, and queer people. A lot of these identities intersect, and their experiences, many of them include marginalization. And as a person of color myself, I can resonate with some of that. And so during my sessions, especially when topics can get intense, sometimes I can even feel things in my body. I can feel part of my stories that's being triggered. But I need to be very hyper aware of those moments and monitor myself during most those moments because I need to be there for my clients, which highlights how self-care is very important. Um, and this is especially true when we are doing more clinical work right now, and sometimes involves seeing clients back to back. Um, so I would like to share some personal strategies that I found very helpful and necessary for self-care. First is to acknowledge burnout, trauma, and grief as as a norm. It exists, it's not talked about enough, but we need to talk about it more. And secondly is just to be aware of what signals might be there and be mindful of checking in with your body and be aware of signals of burnout. I would highly recommend any clinicians to take a day off when needed and schedule their alone time for self-care and to try to find that work-life balance. I know sometimes it's hard, and even some audience we meet at the conference share that it's hard to take days off, especially in this field that's underpaid, and they need to see certain clients and meet certain caseload to keep their work. Um, but but this doesn't mean um, day off is not needed. Many people need that. Um, I encourage everybody to advocate for themselves, just like how we advocate for our clients. Um, setting setting boundaries is very also important. I do a lot of work remotely, so when I'm not at work, I close my laptop and just do whatever I want, practice hobbies like yoga, things we like. And this is very unique to everybody. So try to find some ways that makes you feel good and also sustainable so that we can take care of ourselves in a more long-term way and keep the work we're doing. And lastly, I just want to share that taking care of our mental health is an act of resistance. Um, a lot of things is happening in this world right now, but um, grasping and taking care of ourselves is a small action that we all can do every day.
Yeah, thank you. And I think also this self-care is an act of resistance in the face of adversity. And really taking that time to regulate ourselves is so important. Not only individually but collectively. So some strategies for collective care is supervision that invites vulnerability and reflection. So are we able to name feelings of burnout? Are we able to name feeling secondhand trauma or vicarious trauma? Or exhaustion, peer support that doesn't rely on productivity, able to just relate on these hard feelings, a space for your grief to breathe, intentional rituals like check-ins, shared silence, or art. Love parallel play. Art is so good for the soul and really just helping us kind of digest what we've seen throughout that day or what we've heard. Um, and ultimately holding space for grief as part of a professional life, especially in the helping profession. Um, it's something that we deal with and see and experience a lot throughout this field. I also want to come back to a slide, this small group discussion. So we broke people up into small groups at the conference and had them explore these questions, um, and received quite a variety of responses. But one thing that we talked about is that working with LGBTQ patients or clients wasn't addressed in most people's sites, and um, a lot of places didn't really talk about burnout, grief, or vicarious trauma. There were some sites that said when they reached the point of burnout, supervisors noticed and would make comments, but ultimately, we realized we weren't having enough conversations about this. Um, yeah, and these are our references, and here are our emails. And Faye, I think we were going to talk a bit about our experience at the conference, right?
Yeah, we can briefly share our experiences at a conference. And yeah, this is both Kyler and I's first experience ever at a professional conference. And before going, we are both excited and nervous. Um, but it the turnout was pretty good for our conference, for our workshop. Uh, there were, I think, around at least 60 health professionals who attended. A lot of them also work in the mental health field, and some of them are counselors who are already licensed, some of them are psychologists, and there's also social workers. Um, I think one thing I want to share about my conference experience is that I get to see so many interesting topics that's not covered in textbooks. And I would highly recommend any fellow students or whoever is watching this video to um, strive for an opportunity to go to a conference if there is one. Um, there are topics such as how to work with families with kids who are intersex. And also, I went to a workshop that teaches us the experience of bisexual women, which is so specialized but very in depth, and that's taught by people in the field who have done significant research on these topics. So I think they definitely expanded my eyes, and if there's an opportunity, I would encourage people to do so.
Yes, I agree. I was very excited and very nervous, like you, Faye. Um, but it was such a great experience. One, hearing from clinicians in the field what they were experiencing, what they were hearing, what self-care practices they had was super useful. And being in a space, an LGBTQ affirming space, was um, enlivening. Like it truly was such a special experience to see all of us coming together to support people in our community. And there were workshops ranging from talking about different disorders and different perspectives, clinical humility, self-care, sex, all of these different rich topics that we might not be able to talk about in educational settings. Um, and I think one highlight that I love from not only our presentation, but from the conference in general was centering dedication and attention to clinicians themselves and what we need to support
Mm.
ourselves and our clients. Um, and if you have any questions for us, you can reach out to us through our emails. Um, and I thank you guys for attending.
Thank you so much.